Hello everybody. Our lecture today is entitled Cancer Treatment. Our outlines in the cancer treatment is surgery, chemotherapy, and radiotherapy. Cancer can be treated by surgery, chemotherapy, radiation therapy, immunotherapy, monoclonal antibody therapy, or other methods. These treatments, according to the choice of therapy, this choice depends upon the location of tumor, the grade of the tumor and the stage of the disease, the general state of the patient, performance status. You know the grade of tumor and the stage of disease. We have two types of therapies, traditional therapies and new therapies. The traditional therapies are surgery, chemotherapy, and radiotherapy. The new therapies are immune therapy, gene therapy, stem cell therapy, nanotechnology, tumor therapy. Traditional therapies. Surgery. What are the aims of therapy? The aims of therapy are prevention, diagnosis, and the treatments. Chemotherapy. What is chemotherapy? Chemotherapy, also called chemo, it is a type of cancer treatment that uses drugs to destroy cancer cells. The aim of the chemotherapy divided into two mechanistic processes, may be cytotoxic, means toxic to the cell itself, or anti-neoplastic, means it prevents the growth of the tumor from the origin. How does chemotherapy work? Chemotherapy works by stopping or slowing the growth of cancer cells, which grow and divide quickly, but it can also harm healthy cells that divide quickly, such as those that line your mouth and intestine, or cause your hair to grow. Damage to healthy cells may cause side effects. Often, side effects get better or go away after chemotherapy is over. What does chemotherapy do? Depending on your type of cancer and how advanced it is, chemotherapy can. Chemotherapy can cure cancer when chemotherapy destroys cancer cells to the point that the doctor can no longer detect them in the body and they will not grow back. Chemotherapy can control cancer when chemotherapy keeps cancer from spreading, slows its growth, or destroys cancer cells that have spread to other parts of the body. Chemotherapy can ease cancer symptoms, also called palliative care, when chemotherapy shrinks tumors that are causing pain or pressure. How is chemotherapy used? Sometimes chemotherapy is used as the only cancer treatment, but more often you will get chemotherapy along with surgery, radiation therapy, or biological therapy. Chemotherapy can make a tumor smaller before surgery or radiation therapy. This is called neoadjuvant therapy. Chemotherapy can destroy cancer cells that may remain after surgery or radiation therapy This is called adjuvant chemotherapy. When chemotherapy used in combination with radiation or surgery and taken before them, it's called neoadjuvant chemotherapy. If chemotherapy was taken after surgery or radiation therapy, it's called adjuvant therapy. Chemotherapy can help radiation therapy and biological therapy to work better. Chemotherapy can destroy cancer cells that have come back, recurrent cancer, or spread to other parts of the body, metastatic cancer. How is chemotherapy given? Chemotherapy may be given in many ways. Maybe through injection. Chemotherapy is given by a shot in a muscle in your arm, thigh or hip, or right under the skin in the fatty part of the arm, leg, or belly. Maybe intra-arterial. The chemotherapy goes directly into the artery that is feeding the cancer. Maybe intravenous. The chemotherapy goes directly into the vein. Intraperitoneal. The chemotherapy goes directly into the peritoneal cavity, the area that contains organs such as your intestine, stomach, liver, and ovaries. Chemotherapy can be taken topically and comes in a cream that you wrap onto the skin. Maybe orally. The chemotherapy comes in pills, capsules, or liquids that you swallow. What are the side effects? Side effects are problems caused by cancer treatment. Some common side effects from chemotherapy are fatigue, nausea, vomiting, decreased blood cell counts, hair loss, mouth sores, and pain. What causes side effects? Chemotherapy is designed to kill fast-growing cancer cells, but it can also affect healthy cells that grow quickly. These include cells that line your mouth and intestine, cells in your bone marrow that makes blood cells, and cells that make your hair grow. Chemotherapy causes side effects when it harms these healthy cells. The most side effects are anemia, appetite changes, bleeding of unknown cause, constipation, diarrhea, fatigue, hair loss, infection, infertility, mouth and throat changes, nausea and vomiting, nervous system changes, pain, sexual changes, skin and nail changes, urinary, kidney, and bladder changes. Chemotherapeutic drugs may be alkylating agents, nitrosoureas, antimetabolites, anthracyclines, and related drugs, topoisomerase inhibitors, mitotic inhibitors, and miscellaneous chemotherapeutic drugs. Radiation therapy. Radiation uses high energy X-rays, electron beams, or radioactive isotopes for damaging or destroying malignant cancer cells. The main objective is destroying cancer cells within minimum injury to normal tissue and organ. There are two types of radiotherapy, external or internal. Internal radiation therapy, also called Brachytherapy uses radiation that is placed very close to or inside the tumor. The radiation source is usually sealed in a small holder called an implant. Implants may be in the form of thin wires, plastic tubes called catheter, ribbon, capsules, or seeds. The implant is put directly into the body. Internal radiation therapy may require a hospital stay. External radiation therapy usually given on an outpatient basis. Most patients don't need to stay in the hospital. External radiation therapy is used to treat most types of cancer, including cancer of the bladder, brain, breast, cervix, larynx, lung, prostate, and vagina. In addition, external radiation may be used to relieve pain or ease other problems when cancer spreads to other parts of the body from the primary sites. What are the sources of energy for external radiation therapy? X-rays or gamma rays, which are both forms of electromagnetic radiation. Although they are produced in different ways, both use photons, packets of energy. The particle beam uses fast-moving subatomic particles instead of photons. This type of radiation may be called particle beam radiation therapy or particulate radiation. The types of radiation used to treat cancer may be ionizing or non-ionizing radiation. This table showed some examples of ionizing and non-ionizing radiation. Ionizing radiation more than 10 to 15 electron volt. For example, X-ray, gamma rays, alpha particles, and neutrons. Non-ionizing radiation less than 10 electron volt, such as ultraviolet, microwaves, refractive radiation, ultrasound, and electromotive force. Ionizing radiation used in two major types. Ionizing radiation may be photons or particle radiation. The photons are X-ray or gamma rays. The particle radiations may be electrons, protons, neutrons, alpha and beta particles. The most common types of radiation used in cancer treatments are the high-energy photon, electron beams, protons, and the neutrons. The effect of radiation on normal and cancer cells may be necrosis, apoptosis, or terminal differentiation. And this is necrosis and apoptosis are examples of cell death, and terminal differentiation is completely different. Thank you.